afternoon. This is Sandra Arevalo from Montefiore Nyack Hospital. I'm the Director of Community Health and Wellness. And today we have a whole team here to talk to us about the silent killer. Yes, we have a silent killer in our community. If you don't know who it is, I'm going to tell you the name, hypertension. Yes, so hypertension is killing a lot of our community members. And the reason is because a lot of people don't even know that they have hypertension or high blood pressure. And, next thing you know is that you end up in the hospital. It could be with a heart attack. It could be, with a stroke, something of that nature. And we didn't even know that we were at risk. So for that reason, we're going to have an episode dedicated to this silent killer. And that's exactly the reason why it's called the silent killer. And well, without further ado, I'm going to introduce our team here. I'm very excited. They're all from Montefiore. And let's start at the bottom of my screen. So Dr. Gold, thank you for being here. Tell us a little bit about you.
I work as a cardiologist in Montefiore and Einstein. I'm an associated professor. And right now I am in Mount Vernon Hospital, and I'm very happy to join here to you and to Tim. And let's start talking about the silent killer. It is always in the community.
Yeah, it's the one that nobody's watching, but definitely high blood pressure is watching all of us. So, Dr. Martinez, you're next.
Hi, how are you? Nice to meet you all. My name is Dr. Martinez. I'm one of the DOI1s here in internal medicine residency at Montefiore North Division. I'm happy to be here, happy to discuss a little bit more about hypertension, which is a pretty common disease that we can encounter, and hopefully we can help to demystify some of the things,
Yes, thank you. Dr. Samant.
Hi, everyone. I'm Sauravi Samant. I'm a second-year internal medicine resident at your Montefiore Wakefield Hospital. And I'm also equally excited to talk about hypertension today.
And Dr. Suku?
Hi, everybody. My name is Dr. Asta Suju. I'm one of the teaching hospitalists here at Montefiore Wakefield campus that I've been working with our residents and also Einstein medical students, and I do take care of the patients when they are being admitted to the hospital. And when we address the hypertension, unfortunately at that level, that we do see some consequences already, but I think this is a good time to talk about the hypertension. Yeah, thank you.
So hopefully, Dr. Suju, we leave you without any patients to see after this presentation. Hopefully, we reduce the amount of patients and amount of work that you have. We'll see how well we do it. You let us know a few months from now. So,
Sure.
Do you want to share the screen? We can start the presentation. Beautiful. I can see it.
Yeah. So basically, hypertension, spotting the signs and taking actions. This presentation is meant to give a little bit of background and more insight about a very common condition, disease that we see in the community. And sometimes people overlook this disease. So hopefully it's going to be helpful, and people can engage more into the care of hypertension, and of course taking measure for preventive actions that can be put in place. So what is high blood pressure? Of course, we have to start with this. High blood pressure, also known as the hypertension, I mentioned before, it's a very common disease that affects the walls of the arteries and the veins, but mainly the arteries. And basically, it's a reduction of the wall diameter, which increase the pressure which the blood is going through, and it will cause, at the end of the day, high values on the blood pressure measurements. Okay, if we talking about these blood pressure measurements, we have a systolic and diastolic. But we're going to talk about a little bit more in detail later on. But mainly, The systolic represents the high values that we see in the monitor, and the diastolic represents the low values, or the bottom part, which is seen in the monitor itself. Okay, so blood pressure, hypertension is a blood pressure above 130/80 millimeters of mercury. That's how we measure it in units, and that's considered high. Okay. As we mentioned before, and this targeted by Ms. Arevalo, the high blood pressure or hypertension is our silent killer. Okay. Most of the time, we don't know or we cannot recognize hypertension because there are not clear signs or symptoms of this pathology until it's very late. So I would say this kind of diagnostic comes in hand to hand between doctors as well as patients recognizing the symptoms, which is very important. Okay. So recognizing the symptoms is something that we really want to learn how to do. We're going to teach you how to do it. Protecting yourself, okay, be aware of all those risks, okay, lifestyle modifications and everything that we can do, or anything that can predispose you to suffer from this condition. We have to be conscious about it. Also, know the numbers. Know the numbers is how much is my blood pressure today? How much is my blood pressure on a daily basis? And I have to be aware what are my numbers for my age and my body habits, pretty much. Okay, so here we have a slide depicting all the categorization. We consider normal blood pressure. We can see it on the right, on the left upper corner, moving to the right, SBPs or systolic blood pressure below 120, and diastolic blood pressure, which is the low, less than 80 millimeters of mercury. That's our normal blood pressure. Okay. Elevated, we consider it from 120 to 129 in the high readings, and less than 80 still, it's part of the elevated blood pressure. Then with that, we have the hypertension itself, which is categorized in different stages. We have the stage 1 and stage 2. The stage 1 is considered when blood pressure, the high one, is between 130 and 139, and the diastolic is between 80 and 89. Okay, stage 2 is considered from readings 140 or above, and diastolic or the low readings 90 or above. And this is obtained from the ACC and AHA, which are the biggest institutions that surveil of these guidelines. Symptoms. This is very important. Recognizing the symptoms sometimes is not an easy task because they can be, overlooked. But severe headaches. This is a very important and very common. Sometimes we are in the middle of the day and out of nowhere presenting with severe headache. Usually it's a frontal headache that can radiate sometimes to the back or sometimes to the side of the head. That can raise a little bit of suspicion for high blood pressure. And this means probably the blood pressure is going too high on the brain and is causing all of these symptoms. Okay. As you will see, all of the symptoms that I will mention are related to the constant pressure against the walls of the arteries, which will result in harming of different organs. And you will see all of the symptoms as a result. Chest pain is also not that common, but can be presented. Okay, usually it's a mid-sternal chest pain that can be present time to time. It goes by its own. Shortness of breath also can be present. Difficulty breathing, especially when you are doing any specific activity or under the sun, exposed to high heat. It can rise the blood pressure and it can cause shortness of breath itself. Vision problems. So this is a direct impact into the eyes. So when we have high blood pressure for chronically, it's been there for too many years, it start changing the arteries and all the vessels in the eyes. So in result, we can have like blurred vision or dizziness. Also, sometimes we can present with vertigo symptoms, and this can suggest that we are actually having high blood pressure. By the time this occurs, high blood pressure rates are quite high. So I would say this is important symptom that we have to look out for. Irregular heartbeats, or also known as palpitations. Okay, racing heart. It's part of the symptoms as well. And this means because the heart is working hotter, okay? And as a reaction of the high blood pressure, it wants to accommodate, to establish like regulatory actions in the body, so we can have this racing part. Fatigue as well. This is more pronounced when the hypertension has been present for chronic or for a long period of time in our lives, and we haven't diagnosed this. We can have this fatigue and nose bleeding as well. The blood pressure can definitely rupture some bloods. Some blood vessels, especially in the nose, we can notice this. So the way I like to see hypertension in simple terms, I would say, it's like having a hose and you have the water. What happens when you press down to the hose and, like make it smaller, the water will come in a higher pressure. So the same is happening to our vessels. And all of these symptoms are results of all of this changes that we can have in blood pressure itself. How to screen and diagnose hypertension. So it might look simple, but there are some caveats that we have to know. First off, of course, measuring the blood pressure. Okay, we can do it at home. We can do it in our PCP. We can do it in our office. You can do it in the pharmacy. Okay, I think nowadays it's pretty common to find a blood pressure machine. If you don't have one, you can go to the pharmacy. Sometimes they can provide you with this service. I don't want to mention any pharmacy itself, but it can be widely found in the US itself. So there are some measures that we have to do before taking the blood pressure. If I'm coming from walking outside and I take a seat on my chair and I want to measure my blood pressure, it's probably going to be high. So we have to do a few things just to make sure the blood pressure readings that we're going to get from that are as specific as possible. So we have to take a seat at least for 5 minutes. Okay, we would have to avoid any exercise, walking, or any caffeine, smoking in the past 30 minutes. Okay, so this can, it will not affect the readings itself. And while we are measuring the blood pressure, we have to avoid talking. And this is a very common mistakes that we kind of find. And when we're measuring the blood pressure, because we don't realize that the talking actually can exert some pressure on the vessels that we have in the abdomen, and this in consequence would generate higher blood pressure readings. Okay. Yeah, so once we have fulfilled all of this, we just take a seat, we measure it. One of the things that we do is we try to constantly measure the blood pressure at least in 2 or 3 separate readings. That means can be on the same day at different times, or it can be on separate days on different settings. So we can make sure that the blood pressure readings and the numbers that I'm getting from that machine are actually the ones that are there, are the reality. The cuff size is also important. You have to raise aware of this. If you feel it too tight as soon as they're putting it in, probably it's not the right fit for you. You have to see the cuff size have to wrap around and have like a little overlap of the loose part of the cuff size, and has to be loose, not that loose, but not tight enough when you're starting the blood pressure measurements itself. Yeah. Okay, so this slides over here, it's talking about helping the community through research. So hypertension is a very common disease that can impact the daily living and also has very detrimental consequences that we really want to avoid as physicians. Okay, so one of the things that's important is to be aware of all of this studies that are going on right now. And something is worth mentioning that half of the US adults suffers from high blood pressure, and they may not even know it. Okay, this has been studied in the past. People go, without noticing they have high blood pressure until something happens. And usually when something happens, it's already too late and there are consequences over there. People with high blood pressure, diabetes, and heart disease are increased risk. So this is also important. If you have diabetes, also you have any cardiac conditions like valve problems, any wall problems, or structural problems of the heart, you may be predisposed to suffer from blood pressure, even though that you don't have it at the time they diagnosed this previous condition. African Americans are among the highest rates of hypertension. This also includes Latino population as well. So they're one of the highest that we have to consider. Yeah. Type of hypertension, we have the primary and secondary hypertension. Primary hypertension, we call it essential hypertension. This is a more silent one. It comes gradually over time, over the years. We don't see it, but if we tend to trend the blood pressure measurements, we can see this. It's kind of increasing year by year, and we don't see it until we kind of measure our blood pressure regularly. And this is the most common one. Secondary hypertension, usually it's after any problem from any of the organs, like kidney problems, obstructive sleep apnea. Those big snoring people, they might be predisposed to the thyroid problems as well. They can predispose you to have secondary hypertension as a general aspect. Okay. Talking a little bit about secondary hypertension, is usually presented as an uncontrolled hypertension. What does it mean? What is uncontrolled hypertension? I'm supposed to be taking any meds when I have the hypertension. I have one med or two meds, and I'm not responding. My blood pressure is still high, even though that I have medication, that I'm taking my medication regularly. Okay, so when I'm on the third medication, we start to suspecting that something is not quite okay, and maybe some other organs can be affecting this blood pressure measurements and can be causing the secondary hypertension. We do a screening, okay? So it's very specific. When we suspect secondary hypertension, we try to do some hormonal studies that we have to measure blood tests for this. Basically, there are some conditions that we also evaluate. If the patient categorizes or meets any of this criteria, then we start doing this screening test. Okay. So for this screening test, we usually do it on the clinic, okay, in the office, or in the hospital itself. So yeah. There are some high blood pressure, hypertension effects. The short terms, long terms. Short terms effects pretty much is increasing the work, the pumping activity of our heart. Okay, and this we can notice with some of the symptoms that we already mentioned before, such as palpitations, racing heart, or chest pain. And also part of the short-term effects is decreasing the space of the diameter of the arteries. I'm sorry, the diameters of the arteries, which this can actually lead to another complications, which are strokes or MIs, which are infarctions of the heart. Long-term effects. This is pretty much when the hypertension expresses itself as a condition, and it's more apparatus. So it's heart disease, stroke, kidney disease, eye problems, sexual dysfunctions, and cognitive decline. Okay. Yeah. How do we manage blood pressure? First thing is dietary adjustment. I would say lifestyle modifications are the most important part. Okay. This has been proven in multiple studies over the years, and the dietary adjustment are very, very important. We're going to discuss later on about this. Regular exercise as well. Weight management, of course, this comes in hand in hand with the exercise and diet as well. Decreasing the weight can help us to reduce pretty much the blood pressure based on the diameter of the arteries itself. Limiting the alcohol and avoiding tobacco, those are predisposing, I would say, substance that can lead us to have hypertension, and correlation has been positive. Stress reduction. Nowadays, we know we live in the modern era. We are doing so many things at the time. We can be under stress. So managing stress is very important and helping us to prevent hypertension itself. Regular monitoring. Go to your PCP. This is something that's overlooked. Go to your PCP, to your primary care doctor, and tell him, hey, measure my blood pressure. I want to check every time that I come here, even though that historically I don't have high blood pressure, I may develop in the next year, and I didn't realize unless I'm checking my blood pressure regularly. Or go to your pharmacy and check it. Have a monitor at home. That's important, especially when you have history from your family that they have suffered from high blood pressure. that also be principles to this. And of course, medication that we're going to talk about later on. For the dietary adjustment, DASH diet, this is a very common implementation that we have had. The DASH diet stands for dietary approaches to stop hypertension. Okay, and it's mainly focused on Mediterranean food. Okay, this is including some type of food that can help us to prevent certain rises in the blood of components such as lipids, and also can help us to control the sugars. So, in results, we can have a better risk of high blood pressure. This includes healthy foods such as avocados, fruits, vegetables, whole grains. The grains are very, very good for this. Reducing the amount of salt that we're having, that's very important as well. Yeah, everybody knows that salt intake has been associated with high blood pressure, and then yeah, this can help us as well. Including fish, and it's impactful as well. Now, on the other side, decreasing the amount of meat, red meat that we're ingesting. Okay, the sugar or fatty food that we can have, decreasing the amount of caffeine that we're ingesting. It also helps us to decrease, I would say, the chances of having a high blood pressure. Usually there are a set amount of salt that we are recommended. It's 1.5 grams. And that's pretty much what can be found in complete lunch with a dinner, and you put a grain of salt and put a bit of your palms. It will be less than a dime actually per day. For the effects of exercise and weight, so yes, this is, as I mentioned before, lifestyle changes are very important. Keeping yourself active, it will help you to control the weight, and the weight will, and result will help us to avoid high blood pressure. So weight control can be performed as engaging in any activity, engaging in any sports on a daily basis. One way that we have is measuring the time that we spend in a walk or in a jog. So usually if you are engaging in an activity 3 times per week and you're spending more than 20 minutes on that activity, means walking or jogging, that I would say it can help you to decrease the chances of having hypertension, because it's going to regulate your weight as well. So those are roughly measures that we can tell. If I'm engaging in a daily activity for 20 minutes, definitely that's something. And we can see it over here. How much do I do to avoid hypertension? Aim for at least 20 minutes of moderate intensity activity. Okay, what that means is, cycling, jogging. If you're into jog, you can actually walk. However, if you walk, you have to increase the amount of time. Instead of 20, you can do 30 minutes per day to 75, and they can help you as well. This will help you, of course, to decrease the amount of, or it will increase the amount of calories that you're burning per day. So in turn will help you to regulate body weight. Usually we say that 2,000 calories per week, that will be a total of 5 hours of moderate intensity activities. Yeah, that's casual cycling. Okay, losing weight and keeping it off. So this is a more actionable plan for everybody, I would say. You have to set realistic goals, okay? You have to understand where you're standing right now, and you can set goals per week. So aiming to lose 1 or 2 pounds per week, it's a good goal. That's something that you can try to do. If it's not feasible for you, you can try to go lower, but important is to set realistic goals. You can write it down on a paper and you can try to achieve. Developing healthy relation with food. I know this can be very tricky, especially when you have been eating for quite a long time the same food every day, and you love your food, you love everything that you're eating. But making those changes can really impact and can avoid placing the patients in any specific medication. So this is ideal before starting actually any agents. So measure how much you eat, the amount of food that you're eating. It should not surpass every meal, should not surpass what you can have in both of your hands put together, and basically in one big hand, pretty much. So that also talks about the portions and size. Okay, you have also to include colorful food. So you should aim to have like multiple types of food in your plate in terms of grains, fruits, vegetables, and meat as well. Mhm. Meat, yeah. Alcohol and smoking, a big no-nos, right? Everybody knows this. Alcohol and smoking are factors that influence hypertension directly. So some people that they think having a vape, it's not smoking, and this is something that I want to tailor real quick. Is vaping is also considered a part of smoking, okay? Because we're exerting the same damage on the vessels that regular tobacco can do, and this can also predispose us to suffer from hypertension. Okay, so cutting down on alcohol and smoking cessations are very important. There are different type of alcohol, of course, and recognizing the type of alcohol is also important. I have patients before who would tell me, "Hey, doctor, I'm having just a couple of drinks every day. I'm having a couple of beers every day," and they don't recognize beers as alcohol, and this is also important. So going to your PCP and asking for information about what alcohol can affect or which it's considered alcohol is very important as well. You can look up for help. For the medication overview, we have different medication. This is more specific slide. We have medication as diuretics, which is the water pills. Usually are the go-to when a patient is diagnosed with hypertension. You want to start with this. They've been in the market for quite a while, and the side effects are quite low. Then we have beta blockers. The beta blockers help you to reduce the stress that the heart is undergoing. The one that we talked before, ACE inhibitors and ARBs. This we can put it together. Basically, what they do is they want to target changes in the hormones that we have in the body, and those hormones can help us to decrease the blood pressure itself. Okay, by modifying the diameter of the blood vessels once they have exert the action itself. Calcium channel blockers also, they relax the blood vessels. They use a different mechanism compared to the previous ones, but they all at the end, they also do the end goal, which is pretty much relaxing and expanding the vessels to avoid blood pressure. Alpha blockers are part of the treatment as well. These are not regularly used unless other options have not worked. Specifically, central agonist. Before we want to avoid this. It decreases the blood vessels by acting in the central nervous system. So basically, we're sending a message to the brain saying like, "Hey, we have to dilate the vessels," and that's how it works. Vasodilators, these are very specific medication. We tend not to use it that often unless the patients are here in the hospital. And renin inhibitors also. It's a hormonal therapy. Basically, they target a hormone which changes the homeostasis in the body. At the end, it will result in high blood pressure, like blood pressure reduction. So it's a very what we meant with this slide is we have different type of medications, and not all the patients need the same medication. If I have high blood pressure and my neighbor have high blood pressure, or maybe one of my family members have high blood pressure and they taking one medication, it doesn't mean it's going to work for me. Okay, so this is very important because we have to stratify the patients according to what they need. Also, we have to include all the comorbidities, all the conditions that they have, so we can tailor the specific medication that they will require. And one of the things that I want to mention, and Dr. Suju can also help me with this, is all the time, this is a trial and error. There's no specific medication for a patient. Sometimes they are initiating in a diuretic, but they ended up not responding well, and then we have to move to another type of medication. So it's a kind of a trial and error, and it takes time. So you have to be patient according to this.
Yeah, and then your primary care doctor is gonna be able to see how is your blood pressure readings and what are your maybe blood test results showing, like any side effects from that specific medication that if you're having it, that they may need to change. So mostly like in the hospital settings, we do start the medication and in a few days we do see how it's affecting your blood pressure readings and if any like immediate side effects. If not, we do discharge the patients with those medications, but we always ask to follow up with your primary care doctor for long-term controlling the blood pressure and also whether having any side effects or not, that needs to be monitored.
We also have non-pharmacological interventions. These slides kind of a wrap up from part of the things that we have mentioned before. Weight loss, you can see it on the top of the slide. It's very important. Weight loss can help us directly to decrease the blood pressure that we're having, okay? And usually we have a correlation of the weight that we lose and amount of blood pressure that we can reduce in terms of millimeter of mercury. So that exists and it's important to recognize this. Healthy diet, the DASH diet is actually, and the impact goes above the medication. If we implement this with weight loss, we can definitely help to prevent and avoid high blood pressure. And also we can help to treat patients with high blood pressure just by weight loss and a healthy diet. Reduction of intake of dietary sodium, we mentioned this before, is less than 1.5. Enhance the intake of dietary potassium. Potassium is also, it's electrolyte, so it can also affects all the membranes and everything in the heart and also in the vessels. So having a control on this is as well. We usually tend to say it's less than 5 grams per day. And potassium nowadays found in multiple food, and it's including many other products. So we usually tend not to worry too much about it, but it's important. Physical activity mentioned before, aerobic, 90 to 150 minutes per week. This is a moderate intensity exercise I mentioned before, cycling, jogging, running. These are things that actually help us, okay? So keep yourself active. Dynamic resistance, this is more of a kind of a stretching exercises, 90 to 150 minutes as well. These are exercises that tend to be repetitive, okay? We can use dumbbell, we can use stretching bands. This can also help us, okay? Isometric resistance as well. It's also part of the guidelines and pretty much engaging into this activity 4 to 2 minutes. They're targeting like small muscles per se, and it can help us. Usually when we do sessions like this, we do 4 to 5 minutes of exercises and doing the voluntary contractions for this period of time, then we relieve and we can engage for 3 sessions, okay? But usually it's for 10 weeks. Moderating alcohol intake, we mentioned this before, is very important. In men, it's supposed to be less than 2 drinks daily, and in a woman, it's less than 1 drink daily. Of course, we encourage as much as possible not to drink. These are part of the guidelines per se. So there's a phenomenon known as the resistant hypertension. Okay, this resistant hypertension is blood pressure very high, which is not responding to any or all of those measures that I was spoke about. None of the medications, none of the life changes habit or dietary. So when we start having resistant hypertension, I think it's a good moment to to take a pause and review everything with your doctor. Usually can correspond to problem with hormones. Okay, those hormones are strictly related to the blood pressure control, and they can be deranged. Okay, there can be a plaque in the blood vessel that's actually filling the kidneys, which causing this obstruction, and in results will create a high blood pressure gradient, which is not responding to any of the medications. Okay, kidneys as well as the heart are very related to high blood pressure, and this might, suggesting that a resistant hypertension is caused by problem in the kidneys. Sleep apnea, patients who have sleep apnea, they have been studied in the past by pulmonologists or PCP, they have a sleep study. They are being predisposed to this based for pressures mainly, Usually at night when we have the problems breathing, it may pose some kind of, I would say, stress to the heart. And in terms of this stress, the whole system actually accommodates to try to help the heart not to beat so fast or to move the way it's doing it. So while trying to accommodate this, it will impact the whole body and it will create changes. And these changes, once we're awake, it's high blood pressure. Okay, obesity also, the way I like to see obesity is pretty much if we have the adipose tissue, which is the fat, the tissue fat, where the blood vessels are going through, and we have a lot of adipose tissue surrounding this vessel, that will kind of create a more pressure on the blood vessel, and it's hard for the blood vessel to expand. So it will also create a resistance hypertension regardless of medication. Heavy alcohol abuse, of course, this is more related to kind of liver disease patients. Also, medications that we're not supposed to indicate patients are on a very specific medication that can create high blood pressure. That's also part of one of the causes, and we just have to look for side effects. That's one of the things that we do and explore when we have a patient with resistant hypertension. It's just review the whole list of medication to make sure there's nothing affecting its health. White coat versus masked hypertension. This is a very common one. So white coat hypertension, what is it? Is a blood pressure readings that is a patient who is controlling the high blood pressure, or maybe does not have hypertension at all. And whenever he's going to the office to see the doctor or getting an exam or a test done, blood pressure is skyrocketing. And I see it very often. Usually it can be more than 140, but it's not limited just by this number. It can be 150, 160, 170. And what happened is once this patient go back home and they measure the blood pressure by themselves, blood pressure is pretty much within normal ranges, okay? So there are a few things that we have to consider on this side. One of the things is if you have a blood pressure machine at home and you're measuring it's different from the one at the office, maybe your blood pressure machine is not working properly, and that can happen. At the end of the day, it's a device, okay? So this is something that you have to bring up to your doctor if he's not mentioning or she's not mentioning, and bring the BP machine with you, bring the blood pressure machine with you, and you can compare, right, on live. This is a very nice way to see if it's the white coat syndrome or masked hypertension. Yeah, so masked hypertension pretty much talks about it itself. It's a blood pressure that it's emasculated or like some other attributes or other factors per se. And the way we diagnose this is with the things that we have mentioned before, measuring regularly in a setting, in appropriate setting, 5 minutes of sitting down, no exercise, no cigarettes, no caffeine, smoking. This will help us to differentiate masked hypertension from other causes. Just as a take-home point, I would say understanding high blood pressure is crucial, okay? Sometimes we don't have a clear sign, we don't have clear symptoms, and going regularly to your office, to your doctor's office, or checking the BP at home, or the pharmacy can help you to understand your numbers, okay? So by this, I mean, you have to know what is your normal blood pressure. If I know my numbers, the next time I'm going to a doctor and something happens to me, I can say, hey, listen, this is not the regular numbers that I see at home. And they may suggest that you're getting, you're having a hypertension. So this is very important. Symptoms are rare, as mentioned before. However, when they're present, there's better that mentioned. We just mentioned them: headaches, chest pain, short of breath, nose bleeding, the blurry vision, which is, I would say those are the main ones. Lifestyle are key components. I would say more important than the medication is the lifestyle modifications. Body weight control and the diet is very, very important. DASH diet. You can investigate on it. You can read it. It's everywhere. And the products that you can find in the DASH diet are you can get it from any market, any place. So, research and support, always find for support when you're a PCP and on that can help you to investigate this a little bit.
Thank you so much for this very informative presentation. There are a lot of good points here, and thank you for explaining. You basically answer a lot of the questions that I had, and thank you for that because, you know, when we work in healthcare, we always tell people, you need to exercise, you need to eat healthy, you need to lose weight, but it's not always clear why. I think that this presentation makes that very clear, so thank you for that. Now we have a follow-up questions, and I invite the people who are joining us in this live session. If you have any questions or comments, please use the chat, the Q&A, and let us know your questions. In the meantime, I love the analogy that you did with the water stream, with the bottle of water, that if you press on it, then you're gonna get like more pressure. I think that's beautiful. A question that I get almost all the time is like, what's that difference between the high number and the low number, in the sense that what are those two different measurements?
Do you want to take it, Dr. Gold, or like what?
I think they were ready to answer. Let's-
Yeah, sure. So the high readings mainly, those two readings are generated when the heart pumps, okay? And the first reading, which is the high reading, we call it systolic, is the one that we measure as soon as the blood comes out of the heart. So that's the actual blood that goes to all the organs, okay? So as soon as the heart pumps, that blood comes out, and that first blood is actually pushing all the blood in all the systems, and it's filling all the organs. That's what we call systolic blood pressure, okay? The diastolic blood pressure, on the other hand, which is the bottom blood pressure, is the one that generates after that first pump and actually goes back to the heart and fill the coronary arteries, which are the arteries of the heart. So that blood pressure can tell us how is the heart getting filled. Okay, that's pretty much how I like to see it in a simple way, I would say.
Yeah, no, that makes it so clear. Thank you so much. Now, there is also one concern of people, and it's water intake. Is drinking enough liquids good for you or bad for you? How does it affect your blood pressure?
I can take that. So it's not necessarily it's bad for you. Water intake in general is a good advice, especially now that we're in the summer and one of the hottest periods of the year. Having good hydration and especially like good water intake with electrolytes. We have a lot of patients who, when we say fluids, they tend towards sweetened sodas and water. That's not the kind of fluid we would encourage. It would be more like pure water. However, just giving this general statement to everybody that everybody should have a high water intake may not necessarily be true, because there are certain people dealing with other issues, like they have heart issues, they have kidney issues, there are other underlying things. It won't be a blanket statement for all, but in general, having water intake is good, and it will not increase your blood pressure.
Mm-hmm. Okay, so water will not increase your blood pressure. Dr. Gold.
Actually, they can try. If they drink more water, they will go to the bathroom to urinate. And water is a good diuretic also.
Mm-hmm.
And if they can try, if they have fruit with their liquid after eating, they start using more frequent. And all these things help to reduce blood pressure.
Okay. How does blood pressure affect your kidneys?
So overall, in a very bad way, if I have to say one statement, blood pressure, high blood pressure for a longer period of time is really, really bad for your kidneys. And a lot of patients who we see who end up on dialysis towards after many years, a lot of them, including other causes that might have caused the kidneys to go bad, blood pressure has been one of the most common things that we see. And exposing your kidneys to high blood pressure, like how Dr. Martinez was talking about, the pressure on the vessel walls is one of the ways that it does injure the cells of the kidneys, which over a period of time are not able to recover at all. And it's basically a one-way direction.
But I think we should say uncontrolled blood pressure,
Yes.
uncontrolled hypertension. If it's diagnosed, if being treated with the medication, if being controlled by the PCP with the regular, so then if it's under control, not all hypertensive patients are gonna have the, the kidney failure, but it is one of the most common reason that we are seeing uncontrolled blood pressure.
Mhm. Is there a relationship between hypertension and dementia?
Yeah, definitely. Chronic hypertension has been related to vessel changes in the brain, and this ultimately can lead to dementia. Can predispose to many things, not just dementia, but risk of strokes, and yeah, so it does. It is. Usually, these are changes that we see in the long term. A patient who have been diagnosed with hypertension, they have never been too compliant with the medication throughout their life. And then you can see this changes in the 60s, in the 70s, and it can manifest as frank dementia.
Wow, that's scary to know too. So it's like basically the silent killer can affect every organ of your body.
Correct.
That's correct.
Yeah. Okay. So what will be the difference between diabetes and high blood pressure in that sense? Because diabetes is another one that can pretty much affect every organ of your body.
Yeah, that's a good question. Usually diabetes is a sugar problem. Okay, both affect all the organs everywhere. Both affect the vessels, and that's the main issue here. We're seeing two different conditions, but both affect the vessels. And ultimately, this can lead to decreased function of those organs, as the kidney, lungs, heart, cell, brain, all organs. So sugar, or diabetes, what I like to see it is we have too much sugar in the blood, and that blood is kind of attached to the vessels. And when it attaches to the vessel, it doesn't want to let it go. Okay, so it creates like a coat, let's say it that way, and that can affect in the long term the vessels. High blood pressure is not like a coating from anything, but it's coming from the inside. So all the vessels are getting stretched out from this pressure, and it affects pretty much. So it can cause the
Yes. Diabetes also affects the nerves, like the nerve system on top of the vessels, that you may have some more additional effects or consequences, like the on top of the vessel problems, but that's the main thing basically.
Mhm. Wow, thank you for that explanation. That makes it very clear, and I think it's gonna be very clear for all of our attendees seeing this session. Well, we only have like 3 minutes left, so I just want to say thank you. A great presentation. Thank you for doing the PowerPoint and everything. It came out very beautiful, and those explanations are very clear. This is exactly the kind of information we want to bring to the community, for everybody to learn firsthand what high blood pressure is. And, sometimes when we go to the doctor, it's like the words are so clinical that we don't understand really what doctors are saying, but you are a fantastic team. Thank you for bringing it down to our community level. And hopefully we'll see more of you because you're a great team. Thank you for being there. And I love the fact that technology now allows us to, you guys being all the way in the Bronx, we here in Rockland, and still connect. So thank you so much for all of that. Now, next month, We're not gonna start on the 4th because that's July 4th. So of course it's a holiday and I hope that everybody enjoys it healthily also. But the week after is July 11 and I'm gonna invite you to attend Money Management Essentials. So it's basically how to strengthen your financial fitness, improve your financial wellness, and have a very good financial health. So one way or another, we're still in the health topic. Something that we're going to be talking about is also how to deal with those medical bills that you might be getting piled up in a box. So please join us on the 11th. And again, thank you so much, Dr. Martinez, Saman, Suju, Dr. Gold. Thank you for reaching out.
Have a good day. Thank you
It's
for
been
having us.
amazing. Thank you.
Thank you.
See
Bye.
you soon. Bye-bye.
Bye. Bye. Bye.